have been a registered dental assistant for the last 9 years. I'm here today to talk about proper home care techniques. Several important things to remember when we're talking about the proper techniques is the length of time, how many times to brush, the technique to use when brushing, several types of brushes that can be used, such as an electric toothbrush or a manual toothbrush. The importance of toothpaste when the brush should be replaced. Alright, let's get started. How many of y'all know how to properly take care of your teeth at home?
Who knows? Not me.
Okay, there's several simple steps to follow when you're brushing your teeth at home. They're listed on Colgate's website, and step by step, there's even videos out there. I'm going to show you here on this model here in a moment. It's important to brush 2 solid minutes. When it comes to brushing for 2 solid minutes, a lot of adults don't do that. If you feel like you're not brushing that length of time, get a timer or a toothbrush such as a Sonicare that shuts itself off after 2 minutes. The timer is important. It's also important to brush after each meal, after breakfast, after lunch, after dinner, before bedtime. If you have a sugary drink or any sort of sugar in between, then it's important to brush again. Sugar sitting on the teeth, is a cause of decay. Alright, if the proper technique is not being used, then all the teeth are not being cleaned. There are 5 surfaces to our teeth, 3 in which the toothbrush can reach. Then it comes to floss. Flossing in between the teeth, even the back sides of the back molars, is how you get the rest of the surfaces. Alright, let's refer to these cards right here. The proper brushing technique is brushing the gum line at a 45-degree angle. The brush should be on the tooth and on the gums, and tilted up at the 45-degree angle. Gently brush in for 2 to 3 minutes. If you can get in 3 minutes, 3 minutes would be good. Repeat this on all surfaces of the teeth, the upper, the lower, the inside, the outside, and the biting surface of the teeth. This is just showing you the different angles for the different surfaces of the teeth in order to brush. And it's also important to not forget to brush the tongue. When brushing the tongue, it cleans off the bacteria, giving you a fresher breath. Colgate Oral Care Center breaks down each of these steps. It also has the videos that I talked about earlier. Now let's talk about the type of brush that we recommend. Many dentists recommend a soft toothbrush, a soft bristled head, or something like a Sonicare. It shuts itself off after the 2 minutes. Either way, you need the soft bristles. Hard toothbrush can cause damage to the teeth and gums. Smaller head on the toothbrush helps you get to the angles that you just can't reach with the bigger heads. Sonicare toothbrush, the electric toothbrush that I've been talking about, it does most of the work for you. So pretty much you hold it in place and move it around, and it does all the vibrating for you. Toothpaste, there are different options. There's sensitive toothpaste, there's toothpaste with fluoride, whitening toothpaste. There's several out there. The best thing that I would say to do is consult with your doctor or hygienist to see which one is best. Okay, when replacing a brush, it's best to do it when it either looks worn or every 3 months. Worn toothbrush is not going to do you any good. Same thing with electric toothbrush. They have heads that are detachable, and you can throw them away and replace them. I've been a dental assistant for 9 years, and I've experienced this with patients and personally. I remember at one time, my dentist told me that I needed to clean better. I had 13 cavities, and I thought to myself, well, I clean at night before I go to bed. But from the years of experience and what I've read on Colgate and ADA websites, you know, and the care of my hygienist and doctor, I've learned that, you know, the steps that I've just listed and talked about are the importance that keep me from having decay. I haven't had decay in years because I have changed the way that I clean, and I've watched the sugary intake of sodas and other things, and you know, I just haven't had it since I've done all those things. When I talk to my patients about, you know, my personal experience and how they can do better at cleaning and different things like that, they normally say they've never been given the instructions or their memory just failed them. So I give them the Colgate website. They go back and reference it if needed. Alright, so now that we've talked about the different techniques, different toothpaste, things like that, do y'all have a better understanding of how to brush?
Yes. Yes, very helpful.
Alright, so there's several health issues that are involved in bad home care and neglect of teeth. Periodontal disease can lead to heart issues, strokes, things like that. This is caused by the bacteria getting into the bloodstream. This puts people at a higher risk of heart attack and stroke. A theory that the ADA says that bacteria that cause the periodontal disease that releases a toxin into the bloodstream, causing fatty plaques to form in the arteries. Serious health issues can be related, such as blood clots, strokes. When a patient comes in and they've had these issues with heart, there's other things that are needed as well. What we call a pre-med in the dental world, which is an antibiotic that is needed before the patient has a cleaning. It also works if they've had a joint replacement. Stirring up all that bacteria in the mouth can lead to the bacteria getting into the bloodstream, so we do a preventative pre-med in order to prevent what could happen, such as, you know, the bacteria stirring up, getting into the heart, causing death or loss of the joint, things like that. This model right here, this is just an example of what happens with the gums when there is gum disease involved. So if this can do this to the gums, what is it doing to the heart? All right, let's talk about benefits of a professional dental cleaning by a registered dental hygienist. Dental plaque is a biofilm that builds up on teeth that leads to cavities, and if left untreated, you know, can cause more health problems. Cleaning off the bacteria, the plaque, tartar, things like that, keeps you and helps you prevent decay, gum disease. In the long run, it's going to save you money. You know, average $72 is what a cleaning costs. Average filling is between $170 to $300. So it's better to come in, have your teeth cleaned, pay the $72 with or without insurance, and know that you can prevent a lot of things or catch them early, saving you more money in the long run. So taking care of your mouth at home and in the dental chair is important. Proper brushing, proper flossing is all that you need to do. Follow up with your recare, see your dentist, and everything in a sense will be fine if you follow those proper home care routines that I talked about. Only brushing and flossing will not keep your teeth from decaying. You also have to follow the sugary diet, the professional cleaning at a dental office. We have a saying at our office, the only teeth that you should floss are the only teeth you wish to keep. It goes with brushing as well. If you don't brush, you don't floss, you don't come in for your dental hygiene cleanings, then you're more than likely to lose teeth due to decay, gum disease, and other things. I hope that y'all have a better understanding of how to take care of your mouth, and be sure to see your dentist. Thank you. I'm probably